Scarman.
Thank you, my lady. Prynhawn da a chroeso I Gymru. Good afternoon and welcome to Wales, my lady. I appear on behalf of Covid-19 bereaved families for Justice Cymru. 12,510. The number of deaths registered in Wales where Covid-19 is mentioned on the death certificate as at the 2nd of February 2024. Countless lives lost and so many more shattered. Against this context, the Welsh bereaved are still fighting for truth, justice and accountability. Module 2B will scrutinise the Welsh Government pandemic response. During the pandemic, the Welsh Government asserted its right to do things differently using its devolved powers. It claims to have adopted an evidence-based approach to pandemic response measures tailored to Wales. The Cymru Group has significant misgivings and considers that harmful mistakes were made. Any government would be hard-pressed to match the shocking display of arrogance and central government toxicity within Westminster at that crucial time. However, the inquiry must guard against unhelpful comparisons. The Westminster yardstick sets the bar particularly low. The Welsh Government must be judged not solely by comparison to what was happening in Westminster, but by its own standards, its own evidence, by what it knew and when. This module is particularly important for the Cymru Group, as it remains bitterly disappointed that despite repeated calls from the Welsh bereaved and political community, the Welsh Government has refused to open itself to scrutiny by establishing a Wales-specific inquiry. The Welsh Government has established a special purpose committee to supplement the work of the UK inquiry. However, it lacks teeth and has been likened by one of its own members to using a sticking plaster to treat a bad wound. The Cymru Group considers that the Welsh Government seeks to thwart a granular inspection of Welsh decision-making, seeking instead to hide behind and deflect blame onto the UK Government. And within this context, it is very much welcome that this inquiry will shine a spotlight on the decision-making in Wales and will do its utmost to investigate and analyse fully and fairly the most significant issues impacting Wales. The inquiry's ongoing commitment to facilitating the participation of the Welsh bereaved is also welcomed. The decisions made by Welsh Government must be understood through the lived experiences of the Welsh people. The Welsh bereaved saw first-hand consequences of deficiencies in preparedness and response. They witnessed individual and systemic failures as Covid-19 spread like wildfire through hospitals and care homes, fuelled by derisory testing regimes and inadequate PPE. The voices of the bereaved in Wales must have and will continue to be heard in the powerful testimony to come. Some of the most insightful evidence, my lady, in Module 2 came from contemporaneous informal communications such as WhatsApp and text message. The Welsh Government claims to have disclosed all material within its possession. However, the disclosed material, we say, is belated and dubiously limited. Some within Welsh Government deny the use of informal communication for government business, but this does not ring true or bear scrutiny. Others claim that messages were simply deleted. This is questionable and contrary to the words of the First Minister's official spokesman, who said to the press on the 7th of November 23 that staff were regularly reminded of the need to maintain and retain robust records relating to decisions taken throughout the pandemic. The limited messages that have been disclosed clearly show WhatsApp and text messages used to discuss government business where they shouldn't have been. They show Welsh Government senior special advisors suspiciously and systematically deleting communications. They show special advisors reminding themselves and others that they had agreed, quote, to clear out WhatsApp chat once a week, unquote. They show Jen Renicles, the most senior special advisor for the First Minister for Wales, and Vaughan Gething, Minister for Health, turning on disappearing messages. They show that despite asserting to the Senedd that he did not use WhatsApp, Mr Drakeford was regularly using WhatsApp to discuss policy, announcements, and even to seek clarification on the rules. This beggars belief. The Welsh bereaved look forward to hearing how the Welsh Government justified the use of informal communications for government business and to understand why full access to all informal communication has not been made available to allow for full scrutiny of policy discussions and decision-making via this forum. On science and modelling, TAG, TAC and its subgroups were established, quote, not to recreate all the SAGE mechanisms, but to allow us to simply translate the implications of that into the Welsh context, unquote. Was SAGE's English-centric focus justifiable, and was the establishment of TAG and TAC necessary and effective in achieving its aims? Documents disclosed to the inquiry point to deficiencies in respect of TAG and TAC, with concerns raised in respect of independence, expertise, capacity and coordination. Disclosure from one subgroup suggests that the engagement with TAG was never really formalised, and the commissioning of work was almost completely informal and haphazard. Many requests were verbal and responding to some specific point, with almost a knee-jerk or panic flavour to them. Further, it is suggested that Wales struggled to have its voice heard at UK scientific fora, a small fish in a larger pond, and what impact did that have? The inquiry should also examine the interface between science advice and policy. Did policymakers ask the right questions, and were they able to effectively translate scientific advice into robust policies? The Cymru Group is concerned to read that there has only been a low level of challenge from policy teams to scientific advice, which suggests a sign of policy weakness. Finally, on this topic, it is also of real concern that at the start of the pandemic, the disclosure suggests that Wales did not have any modelling capability, leading to over-reliance on SPI-M models, notwithstanding their, quote, poor fit, unquote, for Wales. Did Welsh Government act quickly to identify modelling needs and mobilise expertise? If not, what impact did this have on the Welsh Government's response? There must be close scrutiny of the Welsh Government's early response to the threat of the virus, including whether valuable time was lost in January, February and March 2020. The inquiry heard in Module 2 that by late January 2020 and by the 4th of February at the very latest, the UK Government should have been electrified into action, and the Welsh Government should equally have been so electrified. On the contrary, the disclosure suggests that the Welsh Government's initial response was slow, chaotic and disjointed, notwithstanding clear evidence that the NHS in Wales was imminently to become overwhelmed. The CTI has stated that the evidence suggests that during February 2020, the virus was not a priority for the Welsh Government, and the Cymru Group agrees. The observations of Public Health Wales' then lead strategic director are also telling. He states, quote, "What I think was missing in the first few weeks from the 8th of January 2020, when I first became aware, to the 20th of February 2020, when the Health and Social Services Group, Coronavirus Planning and Response Group first met, was national strategic leadership and coordination from Welsh Government," unquote. A view also seemingly echoed by the Chief Scientific Advisor for Health. After the first case in Wales was reported on the 28th of February 2020, the disclosure suggests that the response continued to be slow, and the Welsh Government, led by the nose of a clumsy UK Government, failed to act with focus and speed required to anticipate and prepare for the interventions that became necessary. Armed with scientific data, it was open to the Welsh Government as a devolved administration to act sooner. Why didn't it? Why did it blindly follow the UK Government in a case of the blind leading the blind? Why, for example, was the Welsh Government so slow to ban mass gatherings, declining to cancel the Wales versus Scotland rugby match and 2 Stereophonics concerts in mid-March, despite the increasing rates of community transmission evident at that time? Third, what were the consequences of inadequate early response? The disclosure suggests that by reason of the Welsh Government's deficient response, it was deprived of precious time to armour up for battle, to prepare the interventions required. During this lost time, decision makers in Wales could and should have been liaising with key partners, establishing effective consultative fora, and formulating co-produced plans on a whole range of non-pharmaceutical interventions, including track, trace and isolate and PPE, and bolstering the fragmented health and social care sector against the foreseeable demands to be placed on it. Finally, leading the charge on the pandemic was the First Minister for Wales, his cabinet and his special advisors. In Wales, we have a saying, "Gŵr heb bwyll yw llong heb angor," which translates to, "A man without prudence is a ship without an anchor." The inquiry will consider whether this First Minister effectively steered the Welsh ship through the pandemic storm, and did the Cabinet and special advisors serve him well as his second mate. The Cymru Group is unconvinced, perturbed instead by its perception of chaos. Moving on to transmission, The Cymru Group asks the inquiry to examine the evidence which was available at all stages of the pandemic in relation to asymptomatic and airborne transmission. The disclosure is clear that as early as 28th of January 2020, SAGE and in turn the Chief Scientific Advisor for Wales were aware of asymptomatic transmission. The Cymru Group wishes to understand the steps which could and should have been taken from that moment on. Mr. Drakeford, in his witness statement, states that there needed to be sufficiency of evidence before operational decisions could be based on it. In the absence of certainty on asymptomatic transmission, but in the context of clear risk evidence, decision makers could and should have erred on the side of caution. And I note, my lady, that this was an argument traversed at length in Module 2, and Mr. Drakeford's observations in that regard didn't hold up to scrutiny. The failure to heed the risk is unacceptable. One area where the failure to acknowledge risk of asymptomatic transmission had devastating consequences in Wales was in respect of the decision taken to discharge people from hospital into care homes without testing. The accounts of the bereaved are stark. One member of the Cymru Group states, quote, "My father and others were discharged from hospital to care homes across the borough to make room for anticipated COVID patients. None of these people who were discharged were tested," unquote. In respect of discharge to care homes, guidance issued in Wales on the 8th of April 2020 raised that negative tests were not required prior to transfers or admissions into the residential setting, thus essentially endorsing the discharge of potentially infectious asymptomatic and symptomatic patients into care homes. The Welsh Government's eventual decisions on the 22nd and 29th of April 2020 to firstly test everybody being discharged to a care home and later to provide step-down facilities for those who had tested positive, was a change that came later in Wales than in England. Similarly, the decision to extend testing to all staff and residents in care home were not taken until the 16th of May 2020, again, slower than the other three nations. Why did Welsh Government delay in changing its policies to factor in the risk of asymptomatic transmission? Did the Welsh Government give thought to the likelihood of the rapid spread of the virus amongst the most vulnerable? The perception of the Cymru Group is that the delay was akin to a death warrant for the elderly and a stark message from the Welsh Government that they did not matter. A further area which saw similarly disastrous consequences was in respect to the failure to provide timely testing for healthcare workers. One Cymru Group member states, "My father caught COVID while in hospital. The nursing staff were quite open about the circumstances. The nurses had gone to work thinking they had a cold when really they had COVID." Next, the Cymru Group asks the inquiry to scrutinise the issue of airborne transmission. The evidence from Module 2 established that the possibility of COVID-19 being airborne should have been recognised from an early stage. Given what was known, the Cymru Group states that stronger measures should have been taken at an early stage to mitigate against the risk of airborne transmission, including public messaging, guidance, targeted NPIs, for example, mandating the use of FFP2 and FFP3 masks for healthcare workers. Did Welsh Government decision-making accurately reflect the scientific understanding of transmission as it unfolded and adequately mitigate the risks? If not, why not? Next, the events of autumn 2020. In the face of mounting concerns regarding the increasing prevalence of the virus, on 21st of September 2020, SAGE recommended a fire break. What followed was an unacceptable delay by the Welsh Government in the face of failed lockdowns, as it ignored TAC warnings and unjustifiably dragged its feet, with the announcement of a fire break eventually being made almost 1 month later, on the 19th of October. Welsh Government had again let cases get too high before imposing a lockdown. Did it learn nothing from Wave 1? The Welsh Government appears to blame the UK Government funding decisions for the delay, but there is clear evidence to refute this suggestion, which we hope will be put to witnesses. Further, the group wishes to understand why the restrictions introduced following the autumn fire break were, in the words of Wales's Chief Scientific Advisor for Health, quote, "insufficient to control the growth of the epidemic," unquote. What controls should have been put in place, and why weren't they? There are many areas of divergence in non-pharmaceutical interventions between the Welsh Government and the UK Government, for example on testing, face coverings, circuit breakers and relaxation of restrictions. The bereaved want to understand the justification for Welsh Government divergent decision-making when the core science was the same. Further, crucial decisions made by the Welsh Government, such as on testing and face coverings, as I've already indicated, were made later than the corresponding decisions in the rest of the UK. Why? And in particular, the bereaved want to see the rationale for not mandating low-harm precautionary measures such as mask wearing at an earlier stage robustly challenged. There was also significant scope for confusion, disruption and increased risk to those living in Wales by reason of the divergence in NPIs. Given the need for consistent, clear communication with the public, there should have been good reason for any areas of divergence in policy between the four nations. The inquiry must examine whether divergences were based on sound reason or whether, for example, they were politically motivated or otherwise misguided. The inquiry must examine, bearing in mind the risk of confusion, whether the Welsh Government did all it could to seek to prevent repeated and avoidable ambiguity in the UK Government's public messaging and to ensure that its own messaging was crystal clear. Turning to my final topic, my lady, intergovernmental relations. The way in which the UK and devolved administrations interacted with each other in a time of prolonged crisis is a vitally important area of examination. We know from Module 2 that there wasn't a formal structure for regular meetings between First Ministers of the devolved administrations and the Prime Minister of the UK Government, especially after May 2020 when COBRA ceased to meet regularly. Despite this, the evidence in Module 2 suggests that there were plenty of opportunities for regular contact between Welsh Government and UK Government at many levels. Is that correct? If not, if the Welsh Government had concerns about the level of engagement, what did it do about it? The wider question is whether the Welsh Government genuinely sought to forge relations that would enable the best chance of alignment of policy where necessary, or whether there was a tendency towards silos and anti-Tory default position of one-upping and blaming the UK Government. There should have been no place for playing party politics in a pandemic with lives at stake, and the Cymru Group wishes to understand the extent to which party politics and public perception impacted on the Welsh Government's willingness to engage with and approach the UK Government in a spirit of collaboration. My lady, my conclusion will be delivered in Welsh, followed by English, and I'm told that I must pause to allow anybody who wants to listen via the headset to plug in.
Unless the English is a translation of the Welsh?
It is.
Oh, in which case we can wait for the English.
Absolutely. My lady, mae rhai tystion wedi cydnabod bod rhai cymgymeriadau wedi eu gwneud gan Lywodraeth Cymru yn...
My lady, there's been some acknowledgement by some witnesses that some errors were made by the Welsh Government in response to the pandemic. However, the Cymru Group considers the general tenor of the Welsh Government's evidence as one of gloss, minimisation, or the heavy caveat of hindsight. Unacceptable diversions from accountability. The Cymru Group is concerned that the Welsh Government has failed to meaningfully reflect on its decision-making during the pandemic to identify learnings. This concern is somewhat supported by the Welsh Local Government Association's evidence, which suggests that lessons learned exercises completed by Welsh Government have been carried out without input from its key partners. The reality is that disclosure shared with this inquiry suggests that errors were made. These errors caused unnecessary pain and suffering to the deceased and their loved ones. We invite the live witnesses to be reflective, accountable, and to give full and transparent answers to this inquiry so that lessons can be learned. And there will be lessons to be learned, and the inquiry must make findings to prompt change. To cite another Welsh proverb, adfyd a ddwg wybodaeth, a gwybodaeth ddoethineb. Adversity brings knowledge, and knowledge wisdom. Changes must be made speedily in the light of any findings, so that when the next pandemic strikes, as it inevitably will, the people of Wales will be better protected from harm and loss of life. Arglwyddes, Mana.
In the response to the pandemic. However, the Cymru Group considers that the general tenor of the Welsh Government's evidence is one of gloss, minimisation, or the heavy caveat of hindsight, unacceptable diversions from accountability. The Cymru Group is concerned that the Welsh Government has failed to meaningfully reflect on its decision-making during the pandemic to identify learnings. This concern is somewhat supported by the Welsh Local Governments Association's evidence, which suggests that lessons learnt exercises completed by the Welsh Government have been carried out without input from its key partners. The reality is that disclosure shared with the inquiry suggests that errors were made. These errors caused unnecessary pain and suffering to the deceased and their loved ones. We invite the live witnesses to be reflective, accountable, and to give full and transparent answers to this inquiry so that lessons can be learnt, because there will be lessons to be learnt, and the inquiry must make findings to prompt change. To cite another Welsh proverb, adfig a ddwg gwybodaeth a gwybodaeth doeth yna. Adversity brings knowledge, and knowledge wisdom. Changes must be made speedily in light of any findings, so that when the next pandemic strikes, as it inevitably will, the people of Wales will be better protected from harm and loss of life. Diolch am wrando. Thank you for listening, my lady.
Thank you very much indeed, Ms Gowan. Very grateful. Mr Straw, any Welsh passages from you?
My lady, I represent John's campaign and Care Rights UK. I'd like to start by reading some excerpts from two letters. The first is from Mrs Jenny Davies about her husband, Marion Davies, to the First Minister of Wales and Mr Gething on the 28th of September. Brilliant. Thanks very much. The first letter is from Mrs Jenny Davies about her husband, Marion Davies, to the First Minister and Mr Gething on the 28th of September 2020. She says, "Do you know when I can see my husband in his nursing home again? I have achieved one 15-minute indoor visit in 6 months. At the moment, there are no visits allowed because of lockdown. How would any human being like it if they received a phone call, which in effect meant, sorry, you can't see your husband anymore, and we're keeping him locked up here?" Baroness Ros Altman, member of the House of Lords, had the courage to say on television recently that loneliness and starvation would be more likely to cause death than Covid-19. A great many people agree with this. The government really needs to listen to John's campaign and authorise one family caregiver to have the right to visit and to be recognised as a key worker. Care home residents are being kept like prisoners and being denied their human rights. That's end quote from Mrs Jenny Davies's letter in 2020. On 22nd of May 2022, a coalition of 60 MPs signed a letter produced by Care Rights UK and John's campaign, referring to the devastating harm and harrowing experiences which the restrictions were continuing to cause for those in care. Still, nearly 2 years on, the problem identified by Mrs Davies hadn't been properly addressed. The letter maintained the call for a right to a care supporter, in other words, a family or friend to provide care. My lady, I start with those two letters because we respectfully submit that the inquiry should focus on people, the individuals who are affected by the pandemic. Core decisions are only significant when they impact on people, and it's important that those decisions are seen through that lens. And in this context, we warmly welcome the fact that this module has started with a video of the experiences of individuals affected by the pandemic. The two letters also illustrate several themes, which I'd like to come back to. For example, for those needing care, the COVID restrictions caused severe and disproportionate indirect harm. There was a failure by core decision makers to take it into account, and more broadly, to take proper account of input from stakeholders. There was also a failure by core decision makers to adjust restrictions in light of that indirect harm. My submissions focus on people needing and providing care. Now, that's not just those in care homes. It's also people receiving care at home, in hospitals, in mental health units, or otherwise. It's not just the young, but also young people. It's not just the old, but it's also young people who are in need of care as well. And we focus on care in part because it's a useful context to illustrate the broader problems in core decision-making. But we also focus on care because this group really was at the sharp end of the pandemic. It perhaps suffered more than any other group as a result of COVID and the response to it. And that's supported by statistics, for example, those which we set out at paragraphs 5 to 8 of our written submissions. For example, in the first 3 months of the pandemic, 39% of deaths in the UK were of care home residents. Many more were deaths of those receiving care outside the care home, for example, in domiciliary care. There was a far higher rate of death of care home residents than in hospitals. There was also devastating indirect harm. This was an emergency within an emergency, and it should have received central attention by decision makers, but it didn't. In many ways, the care sector was overlooked. I'd like to come to some specific examples now, but to summarise those, they show three core things. Firstly, those needing or providing care weren't given sufficient attention. Secondly, core decisions about those in care were flawed. And thirdly, these examples help understand the broader flaws that there were in core decision making. So the first example is indirect harm. Core decision makers failed to pay sufficient attention to indirect harm and to mitigate it. The government obtained detailed evidence about COVID and the extent to which restrictions would tackle it, but comparatively little evidence was obtained about indirect harms. COVID was often the overriding consideration, but decisions should have been made by balancing not just the harm caused by COVID, but the harm that would be caused by the restrictions that would be imposed in response. And that point is well illustrated, we say, by reference to those needing care. Restrictions led to severe indirect harm on those needing care, and that's set out in more detail in paragraphs 14 to 21 and 38 of our submissions. Notwithstanding the high proportion of overall deaths from COVID of those needing care, COVID wasn't the biggest problem for them. In fact, it was only a small proportion of the overall deaths of those in care homes. 83.3% of care home deaths were from causes other than COVID during the pandemic. In Welsh care homes, dementia and Alzheimer's remained the highest causes of death throughout the whole period. Similarly, in domiciliary care, there was a 225% increase in excess deaths in the first wave. The great majority of that was from non-COVID causes, 77%. Yet COVID was prioritised over all else. The restrictions that were imposed caused severe interruptions to medical care and treatment. The number awaiting medical treatment, including serious conditions such as cancer, increased ninefold. Restrictions also prevented contact with essential or family carers, and that meant a loss of critical care and support for those who needed it most. The specifics of this are explained in more detail by the Older People's Commissioner and by John's campaign in their witness statements. For example, they explained that these carers check for health problems, check for sores, dehydration, for pain, help communicate, help to explain whether the individual was suffering pain or to identify medical problems that they suffered. The carers helped to provide medical care, for example, medicine or physiotherapy. And the restrictions interrupted that critical care that they could provide. This, together with the isolation itself, had many adverse consequences which were raised from an early stage. For example, by Age UK, they explained that the restrictions had a profound impact on physical and mental health. Amnesty in 2020 recorded that every single one of the family members and care home staff interviewed by Amnesty International expressed the concern that the prolonged isolation of care home residents had devastating consequences. Similar concerns were raised by many other stakeholders, MENCAP, the Older People's Commissioner, John's campaign, Care Forum Wales, Care Rights UK, the Patients Association, the Alzheimer's Society and others. And yet those concerns were either not listened to or not properly responded to. It was not only a physical and mental deterioration that the restrictions led to, but in addition there was the emotional point of spending the last months of one's life alone and in pain with no support of one's loved ones. And that for many was a critical factor which was forgotten. So there are two issues, we say, really concerning indirect harm. The first is that a number of the core decisions about restrictions were inappropriate in light of the indirect harm. And I'll come back to that in more detail in a moment. The second issue is that there was insufficient understanding of indirect harm by core decision makers and/or a failure to take it into account. That's the view of many stakeholders. It's also the view of a number of those in government. For example, the Chief Information Officer, Mr. Nelson, TAG's policy modelling group, Professor John Watkins, Dr. Chris Williams from Public Health Wales, Dr. Rob Orford, the Chief Scientific Advisor, Professor Michael Gravener, all expressed the concern that not enough was done to understand indirect harms. Even as late as July 2021, TAG expressed the concerns that indirect harms are less well understood and measured, and that was within its 5 harms guidance. So the explanation isn't that this information wasn't unobtainable. It was readily available from an early stage. We look forward to exploring in evidence in more detail why it was that this evidence was overlooked. It appears that this is linked to a broader procedural flaw, which is a failure to take into account information from stakeholders or experts. There were, in this context, in the care context, some opportunities at least to provide comments, and that was positive. For example, the Care Forum Wales, Older People's Commissioner, and the mid-2021 Locked-Out report were opportunities for some people in this area to provide feedback, but that wasn't sufficient. Firstly, it was limited. Few people were invited to provide input. It wasn't a focused consultation on specific issues. But perhaps more importantly, it was ignored. It didn't feed into the core decisions. And that's the view of many stakeholders in this area, including Professor Wincott, who said there was an absence of data on social care, and this was a serious gap in the evidence base for policy making in Wales. A third issue, a third specific example, is the discharge decision in March, April 2020 without prior testing. We agree with Mr. Poole, King's Counsel, that there is no doubt that there was a massive failure of infection control, contributed at least in part to the influx of infected but untested patients into care homes. And we say that was obvious for 3 key reasons. Firstly, there were very high rates of COVID-19 in hospitals at the time. Secondly, those in care were obviously highly vulnerable to COVID-19. And thirdly, asymptomatic transmission was well recognised by the 17th of March. That was the date on which it was announced that people would be discharged without prior testing. The policy was maintained from the 17th of March until the start of May. Large numbers of people, as a result, were discharged into care homes. Now, the reason for the May 2020 decision, the reversal, which was to test people who, even people who were asymptomatic, was because of the recognition of the risk of asymptomatic transmission. But we say that risk was well known well before May 2020, and indeed it was well known before the 17th of March 2020. The evidence of that has been usefully summarised in a decision of the Divisional Court in the case of Gardner. Paragraphs 34 to 125 set out extensive evidence that was known before. And there's other evidence that's before the inquiry. To give a few examples, Professor Watkins, on the 28th of February 2020, in the British Medical Journal, wrote an article which was widely cited, which recognised the risk of asymptomatic transfer. The Chief Scientific Advisor for Health was told on the 1st of April 2020 that there are potentially a high proportion of infectious people who are symptomatic. And yet, despite that, we say it's inexplicable that there was a month's further delay in responding to that at a critical time. So we understand that it will be uncontroversial that the government failed to identify or take into account evidence of asymptomatic transmission, and that's because a Welsh Government Scientific Evidence Advice report in November 2022 itself accepted that discharge without prior testing overlooked the potential risk for asymptomatic transmission. This again illustrates a broader problem in core decision-making, the failure to properly consult stakeholders and experts and the failure to take that information into account. And one specific example of that is that on the 22nd of March 2020, Mr. Heaney told Mr. Gething that isolation facilities in care homes would be put in place to manage these discharges. And it appears that was one of Mr. Gething's reasons behind the decision. But in fact, up to 58% of care homes did not feel able to effectively isolate suspected COVID-19 residents. That's from an Alzheimer's Society survey in May 2020. Again, that information was available had the government properly consulted people, but it didn't. A fourth specific example, concerns restrictions on visits for those needing and providing care. There were stringent restrictions in place, essentially a blanket ban for much of the time, from March 23rd, 2020 until May 2021, and onerous restrictions continued thereafter. The adverse effect of those restrictions had been made clear by mid-2020, perhaps earlier, Many stakeholders had told the government or made public statements identifying the adverse effects, and I've covered some of those earlier in my submissions. They weren't taken into account. They didn't lead to appropriate changes. The blanket ban continued until the 28th of August 2020. At that point, there was a relaxation in the sense that local risk assessments took place, but those risk assessments were only about the risk of COVID. There was no recognition of the problems of indirect harm. There was no balance between that indirect harm and the risks of COVID. In October 2020, the blanket ban was imposed again and continued for a very long time. And in our submissions at paragraph 39, we identify a number of changes that ought to have been made to that ban. One of them was the essential caregiver point that the Johns campaign had been calling for some time. In other words, an individual who can be permitted to visit their relative with a prior negative test at any time, who is provided with PPE in the same way as ordinary staff is provided with it. Another measure that ought to have been taken, we say, is that risk assessments in individual cases should have been carried out. There ought to have been a balance, on the one hand, of the risk of COVID, against, on the other hand, the harm that the restriction would cause, the harm that no visits would cause. In addition, the personal wishes, the autonomy of the individual affected ought to have been taken into account. So, for example, the question should have been raised, does the person prefer to spend their last months isolated, in severe decline, with the increasing risk of death from non-COVID, or face an increased risk of COVID? We say that ought to have been taken into account. And again, these illustrate wider problems with core decision-making. Evidence from stakeholders being overlooked, indirect harm being overlooked, and an inflexible blanket approach being taken, which led to the wrong results. A fifth example is PPE shortages. Sufficient PPE was not made available to those providing care, among others, during the first few months of the pandemic. The evidence of that is in paragraphs 41 to 42 of our submissions, and that appears to be accepted by the government, and Mr. Gething in particular. The main question is why? Mr. Gething suggests the answers include problems in systems for the distribution to social care. So PPE was sent to local authorities, but they did not forward it to care providers. And we hope to explore whether this is a broader flaw in the decentralised nature of social care in Wales and something which ought to be changed. Other answers were given by Care4 in Wales, one of which was that England took precedence. The sixth example is inadequate guidance. There was a delay at the outset of the pandemic in sufficient guidance being produced for those in the care sector. So there was no helpful guidance until the 15th of April 2020, and that was despite a number of requests from stakeholders and despite the great vulnerability of people in this sector. Care4 in Wales and the Older People's Commissioner both indicated that the government was slower to respond to the concerns of the care sector in producing guidance than it ought to have been. Once guidance did come in, at times it was conflicting and confusing. The Older People's Commissioner drew attention to this early on and to the importance of clarity. Her 21st of June 2020 report noted that guidance was often confusing and contradictory. Care4 in Wales mirrored this. Guidance was impossible to follow, and many others did. And yet the guidance continued to be unclear. We've set out particular examples of this, but to pick on two of them. The first is whether unpaid carers should have been given priority for vaccinations, and the guidance really vacillated between whether or not that was the case over a short period. Similarly, John's campaign called for more specifics on what the end of life meant in terms of visits, and that was because that was being interpreted in a very narrow way on the ground, causing real problems. And despite multiple efforts by John's campaign, there was no clarification of the guidance. Again, this indicates concerns of stakeholders were not being listened to by central government or properly responded to. Should there have been a single person within government who was responsible for clarity and consistency of guidance? Should there have been a single person responsible for ensuring guidance was understandable for those who may have difficulty in understanding it? These are questions we hope to explore in evidence. The seventh and final example is a more general lack of support for the care sector. We give various examples of this. but they include care workers were not key workers until October 2020. They were denied testing that was provided to the NHS. Unpaid care was particularly neglected, even though it was the largest source of adult care provision in Wales and the rest of the UK. It was largely overlooked by ministers. A series of concerns were raised about that area, for example, by Carers UK, but they weren't. But very little was done to help. If one takes together the numerous examples that I've touched on above of the care sector being overlooked or deprioritised, it raises some important questions which we hope to explore. Firstly, this was such an important group by size, vulnerability, and the severity of the adverse impact. It should have been given greater attention. Secondly, were the lives of those in care valued less? Were they considered to be less important due to age or illness? Thirdly, were the duties in the Equality Act and the Human Rights Act not complied with? The Children's Commissioner's opening submissions indicate that that's the case at paragraph 6, and we endorse the opening submissions. The Disabled People's Organisation, similarly, draw attention to the Welsh Government's laudable commitment to human rights, but note that it wasn't delivered. It wasn't effected on the ground, and we also endorse those. We look forward to exploring these questions in evidence and being able to revisit them in closing submissions.
Thank you very much indeed, Mr. Straw. A number of the issues you raised, as I'm sure you appreciate, and you've alerted your lay clients, a number of the issues cross over different modules, and it comes with the modular structure. We all know that. There's bound to be overlap. But we'll try hard to make sure that some of the issues you mentioned may get dealt with in a later module, but we'll see how they fit in with the core decision making. But thank you very much indeed. Right, Mr. Freedman.
We act for Disability Wales and Disability Rights UK. They are national disabled people's organisations, DPO, led by and for disabled people. They thank my lady and your team for creating this stage of the inquiry in Wales, as they thank the teams who have done the same in England, Scotland, and are preparing Northern Ireland. As in Scotland, now in Wales, this inquiry is concerned with both a crisis of devolution and a crisis for disabled people. Nothing indicates those two things more profoundly than the figures for Wales that emerged in the summer of 2020. 68% of the people who had died of COVID were disabled people. A terrible ratio of 7 out of 10 deceased in Wales compared to the still shocking 6 out of 10 across the UK as a whole. Learning disabled people, when age is taken out of the equation, were at least 3 times more likely to die of COVID in Wales than non-disabled people, but that number, said the statisticians, could be as much as 8 times. When age is placed back into the equations, these figures reflect the UK's debt to the elder Welsh people, many of whom suffer from respiratory disease because of coal mining and were part of the 20th century's industrial workforce. Once COVID began, awareness of that health legacy did not escape either the Chief Medical Officer of Wales or the Technical Advisory Group. The statements of the Welsh ministers, as well as their professional backgrounds, show a culture of government in Wales that is very different in tone and working practices to the environment that my lady looked at in Westminster. From the First Minister, who trained as a social worker and is a professor of social science, through to the group of civil servants who assisted the politicians, that is not a governing class that was divorced from the humanities of everyday life. And yet, the vaunted social democracy of Wales and the humanist aspirations it has for the role that the state can play in people's lives could not prevent both mass death and real suffering. Why was that so? And what does that tell us about the government of Wales and the union alike? Starting with the place of disabled people in the overall system of Welsh government. First, that system has evolved in a piecemeal and incomplete fashion. That was particularly apparent in emergency planning. The Welsh Government had only taken on Civil Contingency Act responsibilities in 2018. It had no better pandemic plan than its UK counterpart, but never acknowledged as much. What was said in Scotland can be said again here. If Wales knew that it had an older, poorer population, why did it not make itself more ready to protect them? And if it declared its commitment to comply with the United Nations Convention on the Rights of Disabled People, why did it overlook international law obligations contained in the Convention concerning planning, data collection, and engagement with disabled people for the purposes of pandemic preparedness? Second, this was a very bad moment for the four nations to unite in jointly governing a pandemic of this unprecedented nature. Wales, especially its disabled population, its population of disabled people, was seriously compromised in its resilience as a result of austerity. Going into 2020, Brexit had soured relations and monopolised resources. The different geography of UK inequalities was pronounced. The gulf in politics and economics that was blamed for those inequalities was deep. The power imbalance between the devolved administrations and the UK state was significant. Third, Welsh Government may have political commitment to developing equality and human rights, but it is not straightforward to create those things when so much of Welsh public law and economics remain part of the law and economics of England. That is the case even though the Senedd now has lawmaking powers. In Scotland, my lady had Professor Kearney saying, "Who doesn't like human rights?" but emphasising that the critical question is, how are they being enforced? In Wales, my lady has the previous Lord Chief Justice of England and Wales, Lord Thomas, questioning the benefit of aspirational Welsh legislation such as the Social Services and Wellbeing Act and the Wellbeing and Future Generations Act. These laws use the language of rights without it being sufficiently precise to make any rights described justiciable. Indeed, Professor David Feldman goes so far as to call this legislation which bears no law. Finally, on system, there are features of intergovernmental relations that pulled in disastrously different directions. They range from extraordinary oversights like not inviting Welsh representatives to the first 5 SAGE meetings, to truly fatal disputes about the timing of furlough funding in mid-October 2020. All core participants will want the inquiry to look at the rights and wrongs of these matters. But the stance of disabled people's organisations is that humanity is sovereign over state. It is morally imperative to evolve intergovernmental relations within the United Kingdom that assure best endeavours to protect people from being killed or harmed, irrespective of where or who they are. Like all 4 nations, when Wales had to start its COVID planning from scratch, it made mistakes. It thought food packages for those shielding would be distributed by the UK government, only to have to catch up with England when that assumption proved to be wrong. While its experts knew that care homes would be the greatest places of risk, Welsh Government introduced testing later than other nations, although all of them were too late. What Welsh Government did well, and in many ways better than other nations, was to partner with its people. For disabled people, civil servants reached out to DPOs in mid-March to find out what the government needed to learn. Regular meetings between Jane Hutt, the Deputy First Minister and Chief Whip, and DPOs started in early April 2020. Existing structures, such as the Disability Equality Forum, were used more frequently and dynamically also from April 2020 onwards, and new structures on inclusive communication and COVID morals and ethics were created based on liaison with DPO. This is fundamentally different from what the UK government did, and it contrasts with the extent to which Scottish government disengaged from civil society groups in the first weeks of the crisis. It was Welsh government that uniquely in the UK commissioned a DPO-led study of the effects of the pandemic response on disabled people, which became the Locked Out Report. And on the recommendations of the report, it was Welsh Government that set up a disability task force, again, unprecedented in the UK. The outcome of this premium placed by government on social partnering is what the Welsh Government overlooked in crisis planning. It was able to somewhat remedy in scaling up its pre-existing relationships. But the DPO joined the other parties in submissions today to observe that relying too heavily on good relations was not enough. Like the Scottish machinery of government, the Welsh system does not have departments. It is organised into multidisciplinary groups, which in turn each formed of several more focused directorates. The turnover or churn of ministers is seemingly not as problematic as in the rest of the UK. Most ministers served for the duration of the Senedd. Vaughan Gething worked on the health portfolio for 6 years. Rebecca Evans had led local government and finance since 2018. The size of the government was such that all decisions could be taken through the cabinet. Jane Hutt, as lead minister on equality issues, was present on the daily calls and was part of the COVID core group. But there was never a dedicated minister for disabled people, which may explain partly why Wales was not more prepared prior to the pandemic. Further, without a dedicated minister, what worked was left too much to chance, based on the accident of Jane Hutt, who was committed to make things happen, which might equally have led to different outcomes if certain core personalities like her were not in place. There was also a lack of proper auditing by the centre of government on what services were being delivered and withdrawn on the ground via local government. Again, this was outcomes based on relationships and personality, and we say not necessarily enough on process. The Welsh ministers make their case for small state machinery and long-standing collaborative cultures. The question on the one hand posed by Professor Wincott is, was that machinery compromised by cosiness? But the broader question for Wales and the UK is, does government by social partnership scale up in crisis? The DPO want the inquiry to consider how it can and why it must. Turning to expertise, like Scotland, Wales set up its own scientific advice mechanism to ensure local focus on local data. The accusations against SAGE, without criticism of its integrity, is that it was too Anglo-centric in terms of its people, its knowledge and actual product. Like SAGE advice, the Welsh Technical Advisory Group could not escape the constraints of UK Treasury funding. And on this, all the scientists were unsuccessful in persuading the UK government in September and October 2020 to act more forcefully and earlier to stop the second wave. In terms of recognising the discrete experience and rights of disabled people, Wales was arguably more advanced than the rest of the UK. Since 2002, it has sought to govern in accordance with the social model that holds disability to be a societal construct rather than inherent to the challenges of individual medical condition or impairment. The complaint of disabled people in Wales is that during COVID-19, the so-called medical model made a considerable comeback. The reversion can be seen in the linkage of vital services to being on the shielding list, defined as a list of medical conditions. It was Welsh Government that initially acquiesced in the passing of Part 2 of Schedule 12 of the Coronavirus Act, which suspended statutory duties relevant to protecting disabled people at a point when those duties actually needed enhancing. We passed an act, as Jane Hutt lamented, which singles out disabled people's most basic rights as something that can be switched off when expedient to do so. And although not the act of government, it was under Welsh Government's watch that the use of do not resuscitate notices proliferated in an unaccountable fashion. The issue was given UK-wide prominence by letters issued by a GP surgery in Maesteg, which suggested to elderly, frail and disabled people that it was better to use resources on the young and fit, who were said to, quote, have a greater chance of survival. And while Welsh Government quickly committed itself to engagement and partnership with disabled people to a considerably greater extent than the rest of the UK, there are still lessons to learn on how best to do that. Mark Drakeford tells you in his statement that the relationship between the state and the citizen in Wales should be one of co-production, and that expertise never lies solely on the part of the provider. But in order to get beyond aspiration, co-production and co-design need to be treated as a discipline, skill, and law. However more developed that endeavour is in Wales, its practice failed to consistently and timeously feed back on whether recommendations from partners were adopted. Import was still missed at the point of policy formation and planning. Consultation was too often sought about decisions already made. Grassroots DPOs and other third sector also lacked financial capacity to participate. The lesson of all these modules is also that co-production and co-design cannot work without capacity and infrastructure, and on this, data is critical. Wales, like the rest of the UK, made decisions under too much uncertainty, not just about the virus, but about who was where, in what circumstances when decisions were made. In Wales, there were startling gaps. No modelling was done for Welsh care homes because the data was not available. The Care Inspectorate for Wales confesses in its statement to the inquiry that it cannot guarantee that all deaths in care homes were notified to them. Felicity Benet, an important witness who co-chaired TAG and TAC, described data sharing in Wales as, quote, a patchwork that had not finished being sewn together. There was a shortage of data analysts, a sense, real or otherwise, that data was not being properly shared from England, and a view, at least held by Benet, that Wales had not yet worked out how to work as collaboratively with the subjects of data as it should. If my lady then considers protection of disabled people in Wales during the pandemic, despite awareness of the risks, the issues already seen elsewhere in the UK, including lack of access to food and essential resources, collapse of health, care and independent living services, and the suspension of disabled people's rights, all happened here. That lack of protection is what is otherwise that lack of protection in what is otherwise a progressive state committed to the social model creates puzzles for this inquiry, including for those advocating for a change of values as important in its own right. To be considered in this module are therefore the following. First, as with issues of race and gender, Wales has not reached a default position of inclusivity. The locked-out report concluded that the root cause of this is, quote, simple thoughtlessness about the position of disabled people. Second, dynamic and effective engagement with DPO remains essential to correct attitudinal barriers as much as physical barriers that prevail in state and society. Third, missed opportunities to properly use data creates its own dangers, at least as much as misuse of data. It has taken COVID-19 to really bring that to light. And fourth, as was pressed upon my lady in Scotland, human rights are not enough if they do not contain socio-economic rights. On that point of redistribution, the DPO have now made the case several times that UK COVID economics was not radical economics, but limited intervention to maintain some aspect of ordinary wage earning with considerable support of businesses. That was valid, but it was never going to protect disabled people and their low-paid or unpaid carers. From the Welsh Government perspective, the UK COVID economics also put profit and expedience over care when it resisted for those few crucial weeks the scientific advice from both SAGE and the TAG to introduce an autumn 2020 fire break. In Wales, for Felicity Benet, who knew the numbers, it was, in her words, overwhelmingly painful that the UK was insufficiently flexible to enable a 1-month Welsh fire break, only to go into its own a few days later. Whether this was a treasury for England rather than a treasury for the UK, as the First Minister alleges, will be for my lady to decide. But the hierarchy of power in this relationship is unmistakable, and the tragedy of the delay is not disputed. My lady, at the beginning of the address, we said the DPO were thankful for the work that you and the inquiry teams in the four nations were doing, but we did not say why. There are two reasons in particular to be in gratitude. First, what the evidence is showing as the inquiry moves across the United Kingdom is that in many ways, this country of nations has stopped knowing about itself culturally, economically, and politically. The possibilities and challenges of what is happening in each of the four nations are largely not comprehended by governors, academics, lawyers, and businesses, let alone the wider public. It is this inquiry, occasioned and focused as it is on the COVID state of emergency, that is putting together, for the first time, a proper account of what the devolved United Kingdom is and how it is run. Second, in the UK's lost comprehension of itself, disabled people across the four nations have suffered because inequalities have been allowed to grow, aggravated by unequal geographies of income, infrastructure, and comorbidities. COVID was not the great leveller of inequality and division. It was the great revealer of those things. Disabled people constitute the lived and deceased evidence of that reality. It is this inquiry that can help people across the UK to understand why different parts of society have been chosen to suffer profoundly different human experience. Thank you, my lady.
Thank you very much indeed, Mr. Freeman. Mr. Gardner, can we fit you in before we take a break?
I planned 20 minutes, my lady.
Okay.
My lady, I appear before you on behalf of the Children's Commissioner for Wales. The Office of the Children's Commissioner for Wales was established via the Care Standards Act 2000 following the Waterhouse inquiry. This was a judge-led inquiry which concluded that the children in Wales needed an independent champion to ensure that their rights are respected and upheld. Wales was the first country of the UK to establish the post of Children's Commissioner. The Children's Commissioner for Wales is a national human rights institution compliant with the Paris Principles. Independence from government has always been a key tenet of the office's role. The inquiry will hear evidence about how the working relationship between the Commissioner's office and the Welsh Government altered during the pandemic, but the Paris Principles, particularly around independence, remained an important aspect for the Commissioner to maintain in scrutinising and holding the government to account. This module will hear evidence from Professor Sally Holland, who was the Children's Commissioner for Wales throughout the period with which the inquiry is concerned. My lady, the Office of the High Commissioner for Human Rights recognises that in humanitarian crises, including pandemics, human rights issues will often arise. This is both because of the crisis itself and that measures to manage the crisis are likely to have a greater impact upon more vulnerable groups within the population, which include, of course, children and young persons. During the response to any humanitarian crisis, protecting and upholding human rights should be an overarching and key aim of the state. It is essential after the event that human rights are adequately considered and reflected upon in order to strengthen the nation's resilience against future crises. The Commissioner's legal powers include the ability to review how the Welsh Government has exercised its functions. The Commissioner is required to have regard to the United Nations Convention on the Rights of the Child, or CNCRC, in doing so. It is through this power that the Commissioner's Office advises government on draft guidance and legislation through consultation processes and dialogue with officials and ministers. The urgent nature of decision-making in the pandemic necessitated that the Office work closely alongside government to discharge this responsibility and hold the government to account on behalf of children and young people across Wales. In practice, this meant that the Commissioner's Office was asked to comment on draft guidance and public messaging at very short notice throughout the pandemic. For the avoidance of doubt, the Commissioner and her office were not a part of the formal decision-making process at any point, though through the document review process, the Commissioner and her team were able to question to what extent and how the potential impact on decisions on children's rights were considered. Where this review process didn't result in greater clarity, the Commissioner would follow this up in writing with officials, ministers, or the Chief Medical Officer. The Commissioner had decided at the start of the pandemic that the Office had an important role to play in ensuring that children's rights were actively considered in a fast-paced decision-making process. At such a crisis point, she wanted the government to get things right for children, rather than potentially getting things wrong or miss key considerations and then be critical from the sidelines. I turn then to children's rights in Wales. The Rights of Children and Young Persons Wales Measure 2011 requires the Welsh ministers to have due regard to the children's rights under the UNCRC, in exercising all of their functions. In this way, the individual articles of the UNCRC are incorporated into Welsh law through the measure. The Brown Principles set out how due regard should be exercised in practice, requiring decision makers to be actively aware of their duties and to be actively aware in advance of taking decisions, as well as having this in mind when taking the decision. It requires a conscious approach and state of mind. Crucially, a duty bearer cannot satisfy the duty by justifying a decision after it has been taken. Regard to equality generally will not be sufficient to discharge the duty, and it is not a matter of just ticking boxes. It is good practice to keep an accurate and timely record of decision-making and how relevant questions have been considered, but the record in itself may not satisfy or demonstrate how the duty has been exercised if the principles have not been complied with. The primary way in which due regard under the measure is demonstrated in Wales is through a Children's Rights Impact Assessment, or CRIA. The Welsh Government's Children's Scheme, which accompanies the measure, describes a CRIA as the tool officials are expected to use to support Welsh ministers in ensuring the due regard duty is fulfilled. The scheme also requires the Welsh Government to undertake and publish CRIAs on the government website in order to promote transparency. Officials are expected to record their reasons if a CRIA has not been undertaken. The duties under the measure would have applied to all decision-making processes, actions and omissions that fall within the scope of this module. The experience of the Children's Commissioner, as noted in Professor Holland's written evidence, is that CRIA were often completed late, were far removed from the original decisions, and reflected back on the relevant decision. Retrofitting CRIA analysis to fit a decision already taken was not a unique phenomenon to the pandemic, but this was exacerbated by the condensed timeframes for decision-making during the pandemic. For some major decisions, such as school operations, no CRIA was completed at the time. A fully completed template setting out the articles of the UNCRC and available research, evidence, completed many months after the decision had passed, would not advance or uphold children's rights in decision-making processes, as this did not feed into the decision at the time. This does not satisfy the Brown Principles of due regard, nor does it make decision-making compliant with the duties on Welsh ministers under the measure. The Commissioner's team gave initial advice to the Welsh Government to this effect in both April 2020 and again in May 2020. Decisions around opening or partial opening of schools and the use of face coverings within schools are examples of where it was sometimes difficult to follow the rationale behind governmental decision-making, or even what had actually been decided. The Commissioner did not and does not suggest that scientific evidence should not be used to make decisions of this nature. Nonetheless, the Commissioner expected all decisions to carefully and consistently consider the potential impact on children's rights and to clearly communicate the rationale behind any measure that may impede children's access to their rights where this was deemed unavoidable. It was more apparent for decisions directly affecting children that their rights had been considered during the decision-making processes. Now, this includes decisions such as to fund free school meal equivalents during the school holiday periods and the reopening of libraries, which many children had said were of great benefit and importance to them. However, where decisions were in respect of the whole population, such as decisions to reopen hospitality settings in summer 2020 prior to reopening schools, it was less clear how children's rights had been considered. the practice of completing a career as part of a decision-making process that is compliant with and proactively takes account of children's rights is of prime importance to the Commissioner, and it is anticipated and hoped that it will be further explored by this inquiry. I turn to public health considerations. During the pandemic, public-facing guidance was issued from both the Welsh Government and Public Health Wales. The Commissioner considered it was a difficult process at times to ascertain whether decision-making sat with the Government or with Public Health Wales. Queries would be raised by the Commissioner's office with the Government, who would say that this was a public health matter. Meetings with public health officials, however, would say that they needed the Government to take decisions and direct them in issuing guidance. When seeking to scrutinise or influence decisions and the resulting guidance at this time, it was difficult for the Commissioner to understand who held responsibility for what, and therefore where to take the concerns that children and families across Wales were bringing to the Commissioner and her team. This was particularly the case around children's homes. The Welsh Government would issue general guidance pursuant to the legislation around social distancing and other mitigating measures. However, Public Health Wales issued guidance to professionals around their role in managing coronavirus infections. In practice, this meant that children's care homes were in receipt of guidance from both institutions that was not worded the same, leading to confusion over the roles that they should be applying. This, at times, led to a more restrictive interpretation being followed to ensure compliance and without necessarily actively considering children's rights and experiences. This is a matter that could usefully be clarified through the inquiry process to aid communications in future public health crises. I turn to the crossover between reserved and devolved matters, because there were increased areas where the jagged edge of devolution caused practical difficulties when implementing new legislation and guidance in Wales. One sector in which this became apparent was youth justice, specifically youth custody settings. In Wales, there is one youth offending institution, HMP Park in Bridgend, and there is one secure children's home, Hillside in Neath, Port Talbot. Guidance for all justice settings was issued by the UK Government in March 2020 at the outbreak of the pandemic. This essentially confined inmates, including young offenders, to their cells for 23 hours a day. This failed to take into account children's human rights. The Commissioner was involved in discussions with the Youth Custody Service, who instituted a different regime in HMP Park, and they did so swiftly, whereby the boys were grouped into family cohorts to allow them to have exercise, showers and association time in limited and managed groups. This was in March 2020, well before the bubbles concept had arisen for the population at large. It showed what could be done if thought was given to how the health risk profiles might differ in smaller settings of young people, and if primary thought was given to how to safely manage the public health risks, but with children's rights being factored in. More practical difficulties arose and persisted for Hillside Secure Children's Home, as they provide both youth justice places and secure welfare beds. They straddle the guidelines between justice under the UK Government and welfare under the Welsh Government and local authorities. Practically, this impacted upon staffing in the setting and also directly upon the welfare of young people placed in their care. The setting should be commended on the efforts they made to manage these constraints as best they could to support the young people during the time, but the confusion between jurisdictions inevitably caused confusion on the ground. Previous modules and witnesses have explored the possibility of reverting control over decision-making in public health events like a pandemic to the UK Government to achieve consistency. In the view of the Commissioner, this risks oversimplifying the existing devolution settlement. The approach to youth justice is just one example that illustrates how the approach in Wales to children's health and care is inherently different, guided by the UNCRC rights-based approach. It would not be straightforward or desirable for children in Wales to row back on the devolution settlement in a pandemic. The issues seen in youth justice settings also come back to the decision-making processes and resultant guidance, not proactively considering or taking into account the differing health risk profiles for children and young people in small group children's homes, as compared to large residential care or nursing homes, accommodating the elderly and vulnerable. A one-size-fits-all approach has been shown throughout the COVID pandemic not to be suitable or to meet children's individual needs and rights. I turn to the divergence in governmental approaches. Social partnership is a foundational principle of the Welsh Government's approach. It is common for public sector organisations, such as the Children's Commissioner, to be actively involved and consulted during policy and legislative development. This continued into the pandemic and beyond, and is a key feature of the approach here in Wales. The size and scale of the public sector in Wales allows this to be done in a manageable way. This allowed for the Commissioner to be proactively consulted in response to a range of issues affecting children in Wales. Within days, weekly calls have been set up with senior governmental officials and the Commissioner. This evolved into proactive sharing of matters arising, whereby the Commissioner's office was feeding in families' experiences and queries in real time to the government, allowing for these to be reflected upon. And this in turn did allow for appropriate changes in Welsh Government's legislation and guidance. The inquiry may wish to weigh up to what extent this was beneficial and should be preserved, maintained or even extended in the future. Notwithstanding the difference in approach here in Wales, it is apparent that many of the primary decisions were taken by the UK Government, and the Welsh Government were either expected to or chose to fall into line with those decisions. Clear examples in this regard relate to the proposed suspension of social care protections and safeguards and support for children with additional learning needs. The Welsh Government initially proposed to follow the decisions in England relating to fostering and adoption medical assessments and the support for additional learning needs, and sought to inform rather than consult the Commissioner's office on its decision. To its credit, the Welsh Government pulled back on these proposals following constructive challenge, but the initial decision had only involved local authorities, not children and families or those who work on their behalf, such as the Commissioner's office. Had a CREA been undertaken as part of this initial decision-making process, this may have prompted consideration of wider viewpoints and children's rights issues at that initial stage. I turn to the convergence of care settings and risk profile. Now, Module 6 will specifically focus on the care sector, but in relation to decision-making as falls within this module, it is important to reflect on the generic approaches to risk profiles. The Commissioner wishes to highlight that a one-size-fits-all approach to the legislation and guidance fell short of due regard for children's rights. A care or nursing home for the elderly or those with additional vulnerabilities is a clear risk factor when dealing with a public health emergency. However, the majority of children's homes in Wales are small settings, often 2 to 4 beds, usually accommodating teenagers. Larger or group providers may have their own education provision, meaning that young people are only mixing in limited and consistent groups, much like the bubble system or the rule of 6. Requiring children in these settings, through official guidance, to self-isolate for a minimum of 14 days upon every contact with COVID, and to have their contact with their families completely stopped for lengthy and repeat periods of up to 28 days following any sort of outbreak, was inconsistent with their risk profiles and their human rights. Despite many professionals in Welsh Government, Public Health Wales and other public sector agencies recognising this, the guidance was not changed or amended as matters developed and understanding of transmission and risks evolved. Again, we invite the inquiry to consider whether or not this blanket approach to all paid due regard to children's specific and unique rights, and whether it was proportionate to continue with this approach throughout the pandemic. I turn to the voice of children and young people, because Module 2 heard evidence from the former Children's Commissioner for England, Anne Longfield, reflecting her frustrations or disappointment at the UK Government not listening to the need to hear from and speak to children directly. She described governmental indifference to children and their needs. By contrast, there were a number of ways in which the Welsh Government did actively engage with children and young people in sharing messages and listening to their views, such as televised press conferences with the then Education Minister Kirsty Williams, 2 large-scale nationwide surveys of children and young people organised by the Commissioner's Office, and ministerial meetings with children and young people facilitated by the Commissioner's Office. None of this would have happened without the direct involvement and support of the Commissioner's Office, but it is notable that the Government was open to working in this way and to listening to children and young people in making their decisions. The Commissioner encourages the inquiry to consider how this practice can be protected and sustained, or even built upon. I turn to my final point on scientific evidence and messaging. because it is clear that both the UK and Welsh governments had access to scientific data and advice to inform their decision-making processes. But the Commissioner and her team were frequently called upon to comment on or advise on decisions and guidance at very short notice, where scientific evidence on which decisions were made was often not available at that point or at all, which meant that actual decisions themselves could not be adequately scrutinised. The Commissioner was always careful to put out clear and reassuring messages to children and young people at every available occasion, but at times this was hampered by a lack of clarity around the basis of government decisions. Governments will hold all of the information and advice that has led to their decisions, and they are therefore best placed to provide clarity and transparency. This inquiry may wish to consider how that clarity and transparency may assist in clearer public messaging going forward. In conclusion, my lady, children's lives were affected in every way by the decisions of the pandemic. Whilst efforts to reach out to them, to hear their voices and to listen to their needs were made by Welsh Government, often following encouragement or support of the Commissioner to do so, the Commissioner remains concerned as to whether, when and how their rights were properly considered and fed into the decisions which were made which directly affected them. The inquiry will weigh up how well this was done and whether this could or should be done differently in the future. I'm grateful, my lady.
Thank you very much indeed, Mr. Gardner. Right, we'll take a break now. Shall I be generous or not generous? 22, I'll be generous. Mr. Jacobs, I'm not going to look over to the right as I would normally do.
Good afternoon, my lady. This is the opening statement of the Trades Union Congress, the TUC, and the Wales TUC. The Wales TUC is part of the TUC, but is autonomous in matters that are devolved to the Welsh Government. The 48 unions affiliated to the TUC represent over 5 million working people across a range of sectors and across the four corners of the UK. The Wales TUC represents around 400,000 workers in Wales through its affiliated unions. The TUC and Wales TUC aim to provide a voice for working people and to shine a light on the consequences of government decision-making upon the experiences of those at work. In modules 1 and 2, the inquiry heard evidence from Kate Bell, Assistant General Secretary of the TUC. In this module, the inquiry is to hear evidence from Siobhan Taj, General Secretary of the Wales TUC. This opening submission will highlight the loss and sacrifice of those in the workplace in Wales and focus on the approach to decision-making within the Welsh Government. From the union perspective, as with the Scottish TUC and the Scottish Government considered a few weeks ago in Module 2A, the process of decision-making in Wales was one which no doubt had its deficiencies, but was nonetheless underpinned by a process of meaningful engagement and partnership, which was welcome and valuable. As with our opening submissions in each of the substantive hearings thus far in this inquiry, we begin by acknowledging the loss and sacrifice during the pandemic in the workplace. We pay tribute and express gratitude to those who conveyed their stories so powerfully in the Impact film this morning. It was a difficult but important reminder of the horrors of the pandemic and the human stories that unfolded across so many parts of our society. Those in workplace across a number of sectors played their part in the pandemic response. Those in healthcare were well and truly on the front line and endured the dangerous, shocking and exhausting experiences of caring for those who were acutely unwell. As John said in the Impact film this morning, thank God for the nurses that were there. You should see what the nurses were going through. The social care workforce also suffered. It is a workforce that is generally undervalued and underpaid, yet during the pandemic the burden was monumental. As described by many, there were appalling problems with PPE. Kate Bell's supplementary statement in Module 2 gave an account of a member of GMB who worked in social care and described being given a plastic pinny that appeared to be the same as was used in the catering sector for sandwich making. The worker described how distressing it was trying to support those dying in the care home as the virus ripped through it, how it felt knowing that no doctor or nurse would enter the building to administer anything to ease the pain for a dying resident. As a workforce, many in social care felt forgotten, with little press coverage even at the time regarding district and community nurses, reablement, home care and residential care. The worker said, to quote, "COVID has left a lasting impression on care. So many staff have left as they have been sickened by the way it was dealt with. Many staff have said that if COVID hits us hard again, they will walk out of work and never go back in. Who can blame them? I think COVID will always affect us in whatever we go on to do in life. I've had flashbacks from writing this and a few tears remembering," unquote. Of course, there were those in other sectors who faced increased occupational exposure to the virus. Data regarding mortality rates across sectors indicates that process plant and machine operative occupations had the highest rate of mortality from COVID. Caring, leisure and other service occupations had the largest number of deaths of all the major occupational groups. The inquiry has already heard evidence as to the intersection between occupational exposure and socio-economic inequalities. It was often the poorest in society who had the least ability to comply with measures, the least opportunity to work from home, and were most exposed to the virus in health settings and in service jobs. There is also an ethnicity dimension. Professors Nazrou and Bakares have described that those in ethnic minorities were more likely to be employed in sectors that increased their risk of exposure to an infectious agent, such as in transport and delivery jobs, or working as healthcare assistants, hospital cleaners, social care workers, and in nursing and medical jobs. It all points, my lady, to one of the profound consequences of the pandemic, that those who were generally less well off, with greater disadvantage and vulnerability, paid the greater price. It was the price paid by people who kept parcels being delivered to our door, who transported key workers to work, who processed our food, who stacked our shelves, who cared for our sick and elderly, and many others. My lady, two further points of context are, first, the lack of resilience of public services going into the pandemic, and second, the lack of advanced planning. These issues have been the subject of Module 1 and will be the subject of a report from this inquiry. Though not the focus of this module, these issues nonetheless loom large. Whatever the deficiencies and virtues of the processes for decision-making in Wales, very little can be done to eliminate a profound lack of preparedness and resilience. As in England, services in Wales have been hollowed out by austerity, the waiting lists for healthcare, and the consequences of such terrible waiting lists, which were touched on in the Impact film this morning, were worsened by the pandemic but were not caused by it. There is a simple and inalienable truth that healthcare and social care services that are creaking in peacetime will struggle to avoid collapse if a pandemic hits. The report from Module 1 is eagerly awaited, but it appears that the pandemic planning in Wales was as poor as it was in England. The essence of it is simple. Effective pandemic response requires a quick response, but a quick response will be frustrated if there has not been the necessary planning. Many of the real opportunities to reduce the devastating effects of a pandemic such as Covid-19 lie in better and advanced preparation and planning for a future pandemic. My lady, we turn to the issue of government consultation and partnership with unions and the pandemic response in the workplace. An important feature of the pandemic response in Wales was the culture of social partnership, which was well embedded before the pandemic. Boris Johnson's unfortunate words in private meetings were that he could not have, quote, the bollocks of consulting with unions, unquote. In contrast, the approach in Wales was a shared sense of purpose common to government, unions and other partners. As Shavana Taj describes, it is about delivering change by finding shared goals and listening in order to negotiate the best possible outcomes. Mark Drakeford appropriately describes this aspect as one of the most striking characteristics of the Welsh response to the pandemic. As the pandemic hit, the structures supportive of social partnership were in fact strengthened and increased. The Shadow Social Partnership Council, chaired by the First Minister and comprising of union, employer and government representatives, was extended early in the pandemic with third sector partners and the Older People's Commissioners and Children's Commissioners. It was a sensible attempt to expand the breadth of views informing the far-reaching decisions that the government were called upon to make during the pandemic. The Wales TUC participated in various general and sector or issue-specific fora for discussion with the government, which we have described in more detail in our written opening. The result was that the Wales TUC generally felt able to advocate for the rights and safety of workers at the very top levels of decision-making and felt that their input was taken into account. Like all meaningful relationships, it had its frictions, and that can be seen in the evidence. But that, my lady, is a symptom of consulting meaningfully and at pace. Placatory and empty consultation is easy. Meaningful partnership can come with challenges. The Welsh Government's comparatively open approach to consultation and seeking agreement and common purpose is a story told by a number of stakeholders. The Children's Commissioner for Wales has described being proactively consulted, as have the Welsh Local Government Association, the Disabled People's Organisations and the Johns Campaign, although there have rightly been observations about how the processes need to be improved. In the arena of workplace safety, the approach to social partnership bore some advantages. In Wales, the 2-metre social distancing in the workplace was introduced at an early stage as a legal requirement rather than discretionary guidance, as in England. The Wales TUC, working with the Welsh Government, set up a whistleblowing hotline, enabling workers to report incidents of breach. The Wales TUC and Welsh Government also collaborated to introduce a risk assessment tool designed for staff in the NHS, but also used more widely to accurately assess the risk posed to NHS and social care staff. That was intended to enhance staff safety and ameliorate some of the disproportionate impacts. One area of intense frustration, however, was the lack of enforcement of workplace safety. As the TUC and Wales TUC has pointed to on numerous occasions, the Health and Safety Executive is severely underfunded. During the pandemic, unions in Wales found consistent evidence that a significant number of employers were failing to take sufficient precautions against the disease, and workers repeatedly reported not being consulted on workplace COVID risk assessments. Despite clear evidence of a lack of adherence to regulations, the Welsh Government was unable to improve the situation. Another important issue was that of financial support for those required to self-isolate, particularly those on low incomes in higher risk workplaces with inadequate provision for sick pay. A study by Public Health Wales noted the most common challenges for self-isolation included financial difficulty, and the problem was pronounced for those in precarious work, who were more likely to report financial concerns, more likely to report mental health difficulties, and more likely to report having no access to food or medication during self-isolation. The issue was raised repeatedly by the Wales TUC with the government, but the response was mixed, and ultimately no more effective than that of the UK government. In Wales, the same ineffective test and trace support payment scheme was introduced, albeit even later than in England. It was not introduced until November 2020. The reasons for that should be explored, and it may have been influenced by the financial aspects of the devolution settlement for Wales. There were some positives. The Welsh Government did increase the payment from the £500 in England to £750, and the Wales TUC also welcomed the introduction of a fund to support creative freelancers affected by Covid-19. Separately, social partnership contributed to the attempts to address the inequalities of the pandemic. On 1st of April 2020, the Welsh Government invited union evidence on equality impact. The Wales TUC response highlighted the disproportionate impact on a range of groups, including the particular impacts on BAME workers, pregnant women, parents and carers, disabled people and migrant workers. The Wales TUC also launched a survey to enable BAME workers to share their experiences. Next, my lady, we touch briefly on the differences in culture between the Welsh Government and Westminster. We agree with the observation made by some, including this afternoon by the Welsh Bereaved Families Group, that the dysfunction in Westminster should not be taken as some sort of barometer or baseline for assessing government. That would be to set an unacceptably low standard for the governments of our four nations. We do observe, however, that the Welsh Government appears to have avoided some of the dysfunction seen in Westminster. As described, it was more open to partnership with others, but it was also quicker to work within agreed frameworks for decision-making, and there appears generally to have been appropriately formal and reflective discussion within government. Finally, we touch on the issue of collaboration between the Welsh and Westminster governments. We urge a cautious approach to the narrative suggested by Mr. Johnson and others that differences were being sought for differences' sake. The differences may have resulted from a different approach to the balancing of the imperatives of saving lives and of saving livelihoods. As the pandemic progressed, the UK government, at least the Prime Minister and Chancellor, appear to have seen decisions as a choice between saving lives and saving the economy. Some within UK government saw that as a false dichotomy, and that appears to have been the view also of the Welsh Government. As Mark Drakeford has said, for the Welsh Government there was never a tension between these two objectives. If lives could not be saved, then livelihoods would be badly undermined because staff would become unavailable and customers would cease to be customers. For some in the UK government, the debate was between either saving lives or saving livelihoods, as if these were mutually exclusive objectives. My lady, the flaws of that approach have been considered in Module 2. My lady, we conclude with this observation. To some witnesses in Module 2, the deeply unattractive side of the internal dysfunction within the UK government was just Westminster, or an inevitable part of government. As with Module 2A, the evidence in Module 2B demonstrates that a more mature, professional and open form of central government is achievable. It is submitted that the evidence in this module demonstrates the value of a form of government that is open to and meaningfully engages with the views of stakeholders, including trade unions, but also, of course, many others. In that respect, it is welcome that the Welsh Government has confirmed this approach for the future by establishing the Social Partnership Council in law and placing a social partnership duty on devolved public bodies. Unsurprisingly, there is room for improvement. Earlier this afternoon, John's campaign highlighted areas where greater consultation was required, and we say that the approach of consultation and engagement is one which should be embraced but also strengthened in a future pandemic. My lady, that's our opening statement.
Thank you very much indeed, Mr. Jacobs. Mr. Allen.
Good afternoon, my lady, and thank you. As in Module 1 of this inquiry, I represent the interests of the Welsh Local Government Association, which welcomes the opportunity to be a core participant and looks forward to assisting you in any way it can. During Module 1, it was widely acknowledged that the UK's preparedness and resilience for a pandemic was ill-focused and inadequate. In this module, the WLGA asks you and the inquiry team to look at how the Welsh Government could have better used the great knowledge and experience that the WLGA and its members, the WLGA being the representative of all Welsh local authorities, could have provided. Its position, my lady, on this is nuanced. The WLGA accepts that from the outset there was considerable engagement by the Welsh Government with it and with local government more generally. There is, though, a qualification to this point. The nature of this engagement changed over time, from initially being a process of sharing information to later a more meaningful dialogue, and eventually to a recognition of local government as a trusted delivery partner. In short, the WLGA considers that fuller and earlier engagement could well have been more effective. Its position is, therefore, that in any future similar emergency, such engagement should be early enough for it to inform and influence strategy and decision-making, and be undertaken systematically and consistently at both the political and official levels. You'll see most fully how the WLGA develops these points in the first and very extensive witness statement from its chief executive in due course, and also in the shorter second witness statement. The latter prepared after reading witness statements from others, including those working in and for the Welsh Government. But today, in these opening remarks, there are three aspects of the WLGA's position that I wish to state now. First, the WLGA does, of course, recognise that during the pandemic, the Welsh Government had to make decisions under great pressure, time and circumstance, and that this process of hindsight does not readily capture the pressure of the moment, and others today have made the same point. Next, it also recognises that the Welsh Government, though it had extensive devolved powers, had to work in partnership with the London-based administration on some issues. And where this was so, it had significant consequences for the effectiveness and efficiency of government in Wales. Thirdly, the WLGA reminds you that whatever policies were announced centrally, they had to be delivered locally. It is this third aspect, a key point, that I must develop in these opening remarks. In short, the WLGA submits that however apt and well-designed central government policies may appear to be, the success of their delivery will always depend on the capacity of those organisations tasked with their operationalisation. If policy making, whether by the Welsh Government or the London administration, overlooked the need for partnership with local government, its delivery was likely to be suboptimal. Put the point the other way around, it was the extent to which the Welsh Government co-designed its policies with local councils, having responsibility for their delivery, that was a determining factor in their success. This can be encapsulated in two overarching questions for this module. And we note, actually, that these two questions match closely questions posed by Mr. Poole this morning. First, how significant at each stage between early 2020 and summer 2022 actually was that engagement? And secondly, could a more extensive engagement have enriched policy making and delivery? And these are questions about the extent to which co-design between those operationalising and those posing policy could have been. The WLGA's submission is that initially engagement was not as extensive as it could have been, and that had greater use been made of local knowledge and expertise, there would have been a better, swifter impact on communities. Though it also acknowledges that later in the pandemic, there was a significantly increased degree of engagement. I'll make a few points about these submissions. For instance, my lady, you will see from the evidence that the Welsh Government created work groups that operated in a somewhat insular manner for too long before consulting with others. It could sooner have harnessed the skills of the local authority directors of public protection. And there are areas where these bodies could have done more had they known more about the disease and the measures chosen to mitigate its impact, including having more expert resource prepared and available, along with the provision of advice on social gatherings and events. Of course, it must be kept in mind that the Welsh Government was never fully autonomous during the pandemic. Nonetheless, it is submitted further that a more open dialogue with the WLGA and its local council members about the issues that arose from these matters would have resulted in better decisions. For instance, local authorities were not engaged early enough as the pandemic developed. Knowledge and preparations were at times based on what was in the media. The Welsh Government did not involve key response partners early enough. Local authorities were aware of conversations and preparations to consider the impact of a pandemic, but were not privy to the detail and potential response needed. The concepts of a lockdown and the component elements of such a response were not relayed effectively by government. And had a more involved dialogue existed, they could have reviewed resource arrangements around care homes, reviewed systems for engaging and protecting vulnerable people, and prepared enforcement officers to deal with the restrictions on trade and movement. And this planning could have gone on at local level for some weeks before the decisions made on March the 23rd. Moreover, involvement in the creation and content of the regulations, such as the 21-day reviews as they progressed, would have avoided so many minor amendments to the number 2 regulations during the lifting of the restrictions and the reopening of the economy. And before making decisions about the need for rainbow hospitals, the Welsh Government could have reduced the extent to which there was a failure to meet demand, used existing resource more effectively, and created extra time for the consideration of the views of others, such as local authorities. Local authorities and colleagues from the police had a vital role in terms of enforcement and enacting decisions. And yet at times they were informed of changes at the very last moment, or even at the same time as the media, leaving enforcement officers to interpret regulations and guidance, often without an understanding of policy intent and direction. There are 6 specific issues I need to develop in a little greater detail. The first of these is Test, Trace and Protect, TTP. Now, this initiative was very important, yet the National Health Protection Plan was drafted without any full understanding of how it would be scaled up across the whole of Wales. In fact, by May 2020, it was still envisioned as being solely by Public Health Wales. Only eventually was local government asked to help, and subsequently, when this occurred, it led on many of the initiatives associated with TTP. This could have happened earlier, and local authority expertise in managing and operating call centres utilised sooner. Next, there are many issues concerning money and resources. And running through all the relevant issues of this module, this is a key theme. The current dire straits of many local authorities are suddenly more in the news, but it isn't a new story. You will be aware from Module 1 that prior to the pandemic, all local authorities had suffered austerity, budgets under significant pressure for too many years. The point is, they had of course done their best to cope, and as a result, there was a dangerous assumption that local authorities were adequately resourced to deliver the tasks arising from the pandemic controls, even whilst maintaining service continuity. And this assumption was never subjected to any detailed forensic analysis. Some points, though, about this are now quite clear. Local authorities are aware that permanent funding was given to Public Health Wales, whereas local authorities only received some temporary funding for the period now discontinued. Many of the officers deployed to work in health protection supporting care homes, providing expert advice to TTP, enforcing the coronavirus regulations, have left the profession. And the pressures facing public protection services in Wales are set out clearly in the Director of Public Protection report of 2021, Building for the Future. Their recommendations, we suggest, must inform the basis of resource planning with the Welsh Government for the future. So investment is now required before a future pandemic emerges, so as to avoid uncertainties, complexities, and variability such as happened in 2020. And my lady, I emphasise that this isn't just a money issue, but one of capacity and of time and process. The WLGA says that legislation should be drafted now in conjunction with the police, and investment should be made accordingly. And a rolling programme of secondments from local authorities and the health boards into a Welsh Government contingency team would build better relationships, develop a pool of expertise, and enhance understanding across the public sector. Thirdly, my lady, I want to say something about data and communication, such as some others have raised today. It's another area requiring significant investment. It was a key issue during the pandemic, and this is why a better regime is now needed to understand fully the risks and transmission issues and how these can be best explained locally in the future. The picture during the pandemic was again nuanced. The information that was collected and shared did improve over time, and this permitted a greater understanding of both the prevalence and spread of the disease. However, when local authorities and other stakeholders submitted evidence and feedback, it was not so clear where it went and how it was used, or whether it had influenced policy direction. So that's why the WLGA argues that investment in a better understanding of the public health and public protection roles of local authorities is also critical, and that this must address data sharing in detail. My lady, this is a theme you've heard before from me. Local authorities acknowledge that the Welsh Government did use partners to send its key communication messages to them and to specific audiences and communities, though the role that they took in advising the business community should not be overlooked. And finally, on this particular point, the WLGA argues that it's a significant consequence of the diverse nature of our communities that regular TV briefings can only have a limited reach to many of those most vulnerable. Public confusion had to be resolved locally during the pandemic, and the same applied to queries from business about the substantive effect of regulations. My lady, my fourth point concerns the PPE. It's been said that the market was flooded with fraudulent or substandard PPE, and indeed the supply and control of it was inconsistent, failed to meet the required standards on some occasions, and was often described falsely. This, of course, must not be allowed to recur, and there is much that could be done. Local authorities have a better understanding of the trade sectors and the enforcement responsibility to challenge non-compliant product. For instance, the role of the local directors of public protection through their trading standard services has been overlooked. Earlier communication by the Welsh Government could have led to an enhanced market surveillance regime being introduced and to more interventions being made. Fifthly, NPIs. My lady, before I conclude, I want to stand back from these points for a moment to consider NPIs from a different angle. First, NPIs are more than just an issue for local authority engagement with the Welsh Government or for better investment for the future. They have, as you've heard, an intergovernmental aspect. The inquiry will surely note the uncertainty on the scope of NPIs, particularly in border areas, though in fact they diverged both across borders and with further differences between urban and rural areas. It is surely obvious that workability about cross-border issues was essential. There was some note of that, of course, in the film at the beginning this morning. Yet border local authorities received neither advance warning nor time to prepare, nor time to adapt local arrangements. Better engagement with local authorities would have provided more insight into potential consequences around decisions to stay local, the 5 Mile Guide, and the impact upon the vulnerable, along with the restrictions on the sale of certain goods. Local authorities' input could have avoided failure associated with these policies. The next point about MPIs is that they had, of course, significant and social and economic impacts. So a more extensive engagement with local authorities would have had a more positive impact on a range of social and economic issues, such as the impact from school closures, the impact on those who were vulnerable, and the consequences for the local economies. More communication with local authorities on the option of lockdown would have enabled them to use that opportunity to look at remote working options earlier. Finally, I finish with some comments about compliance with those NPIs that were in fact imposed. In practice, local partnership with the police provided invaluable insight on local similarities and differences, and the complementary powers of enforcement agencies provided more effective outputs. Local authority engagement with the 4 Welsh police forces was initially a bottom-up approach, with little engagement from the National Police Chiefs Council or the CPS. However, meetings between the Welsh Government, the WLGA leaders, and the Welsh Police and Crime Commissioners became a good example of joined-up and regular discussion in relation to pressing enforcement issues. Overall, local authorities in Wales believe they adopted a proportionate and mature approach, providing guidance and advice alongside more robust enforcement when appropriate. Their aim for the future is to do that and to do it better, my lady. Thank you. We look forward to assisting you during this module.
Very grateful, Mr. Allen. Thank you very much. And Mr. Kinnear, I think you finished today's proceedings.
My lady, thank you. The Welsh Government welcomes you to Wales, and in particular, it welcomes the inquiry's examination of its decision-making during the pandemic. Scrutiny may sometimes be difficult, even uncomfortable, but it is necessary. That is because fair but unsparing scrutiny is vital to make sure that the 4 nations of the United Kingdom learn the lessons of the pandemic and do so effectively. This module's importance is obvious, but as its work begins, it is worthwhile to restate why. And as the First Minister himself said in his statement, the pandemic touched the lives of everyone, my own, my colleagues, our communities, but none more so than the many families who lost loved ones. I want to acknowledge this loss at the outset and take this opportunity to express my personal sympathies and sincere condolences to those affected and to all who sadly lost loved ones across the nations. The pain and sadness of their losses will last a lifetime, and I will continue to recognise this at every opportunity. Sadly, too many families have lost loved ones. This cruel virus has stolen lives, and it has left their loved ones with questions which they rightly want answered. I would also like to take an opportunity to recognise the suffering of those who continue to live with the debilitating side effects and after effects of the virus. We continue to learn not only of the impacts on our health, but on our society as a whole. I and the Welsh Government are committed and will remain committed to this inquiry and to learn lessons for the future. To that end, my lady, the First Minister and other Welsh ministers, together with senior officials from the Welsh Government, have given statements, disclosed documents, and they will attend to be examined by counsel to the inquiry over the course of the next 3 weeks. Fair scrutiny requires a careful examination of the evidence and analysis that was available to decision makers and their advisors at the time the decisions were made and advice given. As Mr. Poole rightly recognised this morning, scrutiny is not and cannot be an exercise in the application of hindsight, knowing what we now know, 4 years or so since the pandemic started. In answering the inquiry's questions, The First Minister and other Welsh ministers will set out the reasons for their decisions, and senior civil servants from the Welsh Government will explain the advice that they gave, and they stand ready to be examined on the evidence they give. In their opening statements, the Bereaved Families for Justice Cymru, John's Campaign and Care Rights UK and others have raised questions that fall to be answered in this and also in later modules. The precise dividing line between the subject matter of this module and Module 3 and Module 6 is for you to decide. But whichever part of this inquiry you decide the questions are best put, the Welsh Government will continue to answer them in its statements, by its disclosure and in evidence. My lady, the devolution settlements in Wales, Scotland and Northern Ireland have been well established now for more than a quarter century. So Module 2B cannot be a crude exercise in comparing the Welsh Government's decisions against those of the UK Government. England is not the standard against which the decisions of the Welsh Government and indeed the other devolved governments should be judged. The Welsh Government was reassured by your statement last year that there is an obvious value in assessing decision-making across the four nations and the interactions between them. The approach you proposed last August had the advantage of reflecting how government in the UK works. In responding to the pandemic, the four governments had, for the most part, their own powers and responsibilities. Using those powers, they made the decisions that they considered to be in the best interests of their nations. The Welsh Government is, however, concerned that the concept of divergence was used in examination of witnesses in Modules 2 and 2A, and indeed in opening this morning, which suggests that the policy of the UK Government is the benchmark against which the decisions which the Welsh Government's decision-making will and indeed should be considered. For that reason, the Welsh Government should be grateful for the assurance that the substance of examination will reflect the constitutional, legal and political realities of the Welsh devolution settlement. The size of Wales, the stability of its political structures, and particularly the stability of relationships between individuals and public bodies, especially in the NHS in Wales, became a significant feature of decision-making in the pandemic. In making the decisions that affected Wales, Welsh ministers knew daily how decisions were impacting the people they serve. Well-established relationships between the Welsh Government and those on the front line of the response not only enabled a productive conversation, but also robust challenge. The Welsh TUC vigorously advocated for the rights and safety of all workers and, importantly, considered that they were listened to by ministers. That view is also reflected in the evidence of other parties from whom you will hear evidence, including the British Medical Association, the Welsh LGA and others. Cross-party cooperation is commonplace in the Senedd, and working with local authorities, with different political leaderships to the Welsh Government, is the norm rather than the exception. For that reason, leaders of the Senedd opposition parties, together with representatives of other bodies such as the Welsh TUC, the Welsh LGA, the Wales Council for Voluntary Action and the police, attended the core Covid-19 group and were regularly briefed on the pandemic, the relevant data and intended decisions. As has been commented upon by the Welsh TUC and other CPs, the Shadow Social Partnership Council was an important element that contributed to decision-making in Wales during the pandemic. Its membership was expanded and its operations were radically altered to provide a weekly forum for consultation and, notably, informed and open discussion of forthcoming decisions. It was attended by a broad cross-section of the community, including the CBI, the Federation of Small Businesses, trade unions, third sector parties, and the Future Generations, Welsh Language, Older Persons Commissioners, and the Children's Commissioner. The Council had direct access to Welsh ministers and senior officials, such as the Chief Medical Officer, the Chief Scientific Advisor for Health, and the Chief Executive of the NHS in Wales. In the First Minister's own words, meetings were challenging but constructive. The Council heard, in advance of publication, about the substance and timing of intended decisions. The inquiry will rightly shine a light on the impact of the pandemic and the response on health and other inequalities. Since the start of devolution, the Welsh Government has focused on addressing entrenched health and socio-economic inequalities through the law. For example, the Wellbeing of Future Generations Wales Act 2015 promotes equality as an objective for society, and also by policy and other funding arrangements. From the start, the Welsh Government's approach to and understanding of the pandemic was informed by the knowledge that every widespread disease outbreak is more likely to produce disproportionately adverse effects on those who are economically disadvantaged or suffering from some other pre-existing health condition. Since 2010, and uniquely in the UK, Welsh ministers have been required by law to have regard to the UN Convention of the Rights of the Child in their decision-making. They were well used to doing so by the time of the pandemic, and ministers' specific appreciation of the impact of the virus on children inevitably developed as the evidence of that impact was gathered and analysed. Throughout the course of the pandemic, the Welsh Government was acutely conscious of the impact of restrictions on all sectors of society, and ensuring that those most at risk were protected was a major and constant consideration. That imperative came into sharp focus early in the pandemic because of the emerging evidence of the differential impact of the virus on Black, Asian, and ethnic minority communities. Evidence emerged from prominent clinicians who observed that Black, Asian, and minority ethnic colleagues were more vulnerable to catching the disease and suffering from its more serious consequences. In April 2020, the Welsh Government established a Black, Asian, and minority ethnic Covid-19 advisory group to examine the disproportionate impact of the virus. The group had two subgroups. The socio-economic subgroup looked at the broader context of the disproportionate impact, and on the 18th of June 2020, it submitted its report, whose recommendations were immediately implemented. Another subgroup developed a risk assessment tool to help health and social care workers decide whether they were at higher risk from the virus, and that too was swiftly implemented. The Welsh Government's pre-existing Disability Equality Forum was adapted to provide a means of communication and consultation with disabled people, a means, in Professor Debbie Foster's words, were not available to disabled people in other parts of the country. In June 2020, Professor Foster was asked by the Forum to write a report about the experiences of disabled people in Wales during the pandemic. On any view, the subsequent report made for powerful reading. The Welsh Government committed to implement its recommendations. It reaffirmed its commitment to the social model of disability and established the Disability Rights Task Force to implement the report's recommendations. That valuable and necessary work, sponsored by the Minister for Social Justice, continues. There is a higher proportion of older people in Wales than the rest of the UK, and so concern about the impact of the virus and the response on their health and well-being was of critical importance throughout. Data and modelling in Wales took account of the higher proportion of older people in the population, which in turn informed decision-making. The Older People's Commissioner was a member of the Shadow Social Partnership Council, and in that forum, and indeed elsewhere, she was a forthright and respected advocate of the interests of older people. My lady, may I turn briefly to the question of informal communication and WhatsApp messages. These have received, I should say, sustained and intense interest in the inquiry, and for that reason, elsewhere. Given that interest, one point is clear, and as was indicated by Mr. Poole in opening this morning, a careful consideration of the documents, including WhatsApps and other messages, shows that neither Welsh ministers nor senior officials used WhatsApp or indeed any other form of informal communication as a substitute for or a supplemental means of decision-making. My lady, the Welsh Government has addressed you in Module 2 and in writing in this module about the issues which, from its perspective, affected intergovernmental decision-making during the pandemic. As the First Minister repeatedly said at the time, there were obvious and necessary advantages to establishing a regular rhythm of meetings between the heads of government. That was not done, and it was not done because the then Prime Minister was anxious to avoid creating the impression that the UK was a federal state. That concern with appearances did not recognise, and so did not meet, the scale of events confronting all four nations. As was also discussed in Module 2, although there was much to commend the Treasury's response to the pandemic, equally, the pandemic reinforced and illustrated the unresponsiveness of the Treasury and the restrictions of UK-wide programmes. That problem is best demonstrated by the discussions which led to the firebreak in Wales in October 2020. The Enhanced Job Support Scheme was a UK-wide scheme implemented by the Treasury due to start on the 1st of November 2020. Following the Welsh Cabinet's decision in principle to introduce a firebreak in Wales when the UK government did not intend to take the same action, on the 16th of October 2020, the First Minister asked Rishi Sunak, then the Chancellor, to bring forward the start of the scheme by 1 week to coincide with the beginning of the firebreak in Wales. The First Minister explained why many staff in Wales would not be able to make claims on the job retention scheme for that period. He even made an offer to reimburse the Treasury the additional cost of bringing the scheme forward. The request was declined due to, and I quote, limitation on HMRC delivery timelines. Quite what that meant has never been explained by the Treasury. Mr Sunak's recent suggestion that the Welsh Government could and should have used an upfront guarantee was never a practical possibility. The problem was not solely the amount of money provided by the UK Government, but the timing of public health decisions in Wales and the availability of operational support from HMRC. Undoubtedly, Mr Sunak's evidence will be discussed with the First Minister in due course. Although this was a significant example of the problems that could be caused by the existing funding arrangements, unfortunately, the October 2020 firebreak was not the only instance, and the problem remains to this day unresolved. These limitations are flaws in the system, not a single point of failure. The Treasury's unresponsiveness to the need and public health requirements of the devolved governments meant that actions taken by the Treasury to put in place interventions were based solely on instructions from central government. My lady, finally, may I turn to the not straightforward question of recommendations. The First Minister has proposed 2 recommendations touching upon reform of intergovernmental relations and arrangements that allow the devolved governments equal and fair access to funding in the event of a future public health emergency. Undoubtedly, the evidence will reveal others. A fundamental part of the inquiry's work is the formulation of efficient and effective recommendations to put right any deficiencies or flaws that have been identified in the evidence. Consideration of recommendations is never straightforward, as my lady may recall from previous experiences. At the start of modules 1 and 2, the Welsh Government asked the inquiry to publish details of its proposed arrangements for consideration of recommendations, and I repeat that request to you today. My lady, since the start of the inquiry, the Welsh Government has provided more than 100 statements and thousands of documents to the inquiry. Over the next 3 weeks, you will hear evidence from the First Minister and other Welsh ministers, as well as senior officials. As I said at the start, scrutiny is necessary and it can be uncomfortable. And the Welsh Government will continue to provide you in this inquiry with every assistance, and crucially, to answer the questions that the people of Wales rightly want asked. Thank you.
Thank you, Mr Kinnear. Please try to allay the concerns of the Welsh Government in relation to divergence. Yes, you will have heard the word, and I've considered it in other modules, as you've indicated. But I did say something in 2A that may be of some comfort to the Welsh Government. I think I commented at one stage, just because there's a divergence doesn't mean that England is right and Scotland or Wales or Northern Ireland are wrong. So it's merely recording the fact that there is a divergence. It's not suggesting any particular nation is to blame for it. May well be in some cases there is some responsibility attached, but it doesn't necessarily mean the devolved nation has got it wrong by going a different way from England.
I'm very grateful for that, my lady.
Thank you. Thank you, everybody. I think you must be one of the most timely groups of core participants and counsel to the inquiry, finished almost on the dot of the time we had expected. So thank you all very much indeed for your submissions. They were all constructive and sensible, and I shall obviously bear them all very much in mind. And of course, I shall bear in mind any of the written submissions that I've received, either supplementing your submissions today, or if they are instead of any oral submissions from other call participants. So thank you all very much indeed. 10 o'clock tomorrow. All rise.